Hello, I'm Sarah Friel, and I'm an assistant professor in the CSD program at MGH IHP. Today, I want to introduce you to motivational interviewing, or MI, and explain why it's a useful tool for mentoring our CSD graduate students. My learning objectives for today are to describe the 4 core principles of motivational interviewing, which are expressing empathy, develop discrepancy, roll with resistance, and support self-efficacy. The second learning objective is I want you to be able to recognize and understand the role of the OARS skills, which are essential communication tools in motivational interviewing. And these are open-ended questions, affirmations, reflections, and summaries. And thirdly, I want to help you identify change talk, which is a key feature of motivational interviewing. And I want you to leave here being able to give 3 examples of statements that might indicate a student's desire or reason or need to make a change. But first, think about a meeting with a student who was struggling or came to you for help. What was difficult about that meeting? I wonder what went well. And I wonder what intentional skills you employed to support the student. In this talk, I want to tell you about motivational interviewing as a way to build some intentional strategies to support graduate students in their positive change making in their academic lives. So what is motivational interviewing? Well, it's an evidence-based conversational style used in mentoring and therapeutic interventions designed to strengthen a person's own motivation and a commitment to change in an atmosphere of acceptance and compassion. It was developed, it was developed in the early 1980s by Dr. William Miller, who was an American clinical psychologist who considered that treatments he saw that were used to help patients with substance abuse were just too confrontational. Instead, Miller felt that fostering a collaborative and supportive environment and helping clients resolve ambivalence about changing harmful behaviours would be much more effective. In partnership with Stephen Rolnick, a clinical psychologist from the UK, they formalised motivational interviewing, and since then it has been used in a wide variety of clinical contexts. The primary goal is to develop client autonomy, strengthen intrinsic motivation, reduce defensiveness, and then pave the way for effective behaviour change. I believe that the strategies used in motivational interviewing would be helpful in supporting students. Graduate school is demanding, and student clinicians may struggle with stress and self-doubt. And instead of relying on a directive approach of advice giving, motivational interviewing helps us partner with students in their conversations, giving them space to voice their concerns and clarify their own goals and identify their own strengths. And this approach fosters self-reflection and resilience, and then a much stronger commitment to academic and professional success. Evidence indicates that motivational interviewing reduces anxiety and it promotes well-being and positive change by leveraging intrinsic motivation. And it is important to note, however, that motivational interviewing is not a substitute for student support services, counselling, or therapy, but instead it's a way to start a conversation about change. Another advantage of motivational interviewing is its natural alignment with trauma-informed care principles. Motivational interviewing emphasizes empathy, autonomy, and collaboration, and creating a safe and supportive space for students. By listening without judgment and prioritizing the student's choice, motivational interviewing helps avoid re-traumatizing the student and supports an empowering environment. So let's talk more about what the core principles are of or the essential components of motivational interviewing are. Firstly, express empathy. This refers to the way supervisors can seek to deeply understand and reflect the individual's perspective, and using skillful but non-judgmental listening to encourage openness and build rapport. Second is to develop discrepancy. And this describes the way that the mentor can help individuals recognize the gap between their current behaviors and their broader goals or values. This gentle highlighting of discrepancies can motivate internal change, as individuals see how their actions may not necessarily align with their own personal aspirations. Thirdly, roll with resistance refers to the way an advisor acknowledges resistance as a natural part of change and works collaboratively, allowing the individual to explore their concerns but without feeling judged or coerced. The mentor may offer new perspectives, but these should never be imposed. And then finally, support self-efficacy. This is vital. It describes how supervisors can reinforce how individuals' belief in their own capacity to enact change, highlighting their strengths, their past successes, and then providing hope and encouragement. And collectively, these four principles make up motivational interviewing and a student-centered and respectful approach, which can empower individuals to become active agents in their own change process. So let's break down the four core micro skills that make motivational interviewing effective, often called OARs. These are the how-to element of motivational interviewing. First, open-ended questions encourage students to elaborate instead of simply answering yes/no questions, which might be a default if they're feeling challenged or not feeling successful. Secondly, affirmations highlight and reinforce students' efforts and strengths. Thirdly, reflective listening involves restating or paraphrasing what students share, showing you truly understand. Finally, summaries pull together key points from your conversation, validating what was said and then clarifying next steps. And these OARs are the mechanism by which you use motivational interviewing as a framework to encourage change. Many of these strategies are going to be familiar to us as speech-language pathologists, but each one of them, used intentionally, is a powerful tool to support students' own change. So let's think of some examples of OARs. Firstly, open-ended questions might sound like, what are some of the challenges you face in your academic work? An affirmation might sound like, I can see how dedicated you are to learning about clinical skills, even when it feels overwhelming. Reflective listening might sound like, it sounds like you're feeling uncertain about balancing school and personal life right now. And then finally, a summary might sound like this. So, today we talked about your concerns with time management and your desire to find more balance. You've explored options like online platforms to help organize your calendar. Each of these collectively are going to help offer a voice and an opportunity for students to share their concerns. So let's practice. Imagine a student comes to you because they're struggling to hand in coursework on time. I invite you to pause the presentation and spend a minute writing down an example of each of the key OARs responses. Maybe you had something like this. For an open-ended question, you might have written something like, tell me more about your challenge with meeting the submission deadlines. An affirmation might have been, you have a lot of challenges. A reflection might be, you're feeling uncertain, but also curious about what could improve. And a summary might sound like, to sum up, it sounds like you want to improve your work submission timeliness and believe a digital reminder could help. So first, the core principles of motivational interviewing. Principle 1 is express empathy. And why do we do this? We want to create an empathetic, non-judgmental environment. At the heart of motivational interviewing is the idea of understanding the student's point of view. When students feel truly heard and not judged, they're more likely to open up and engage honestly in the conversation. Empathizing doesn't mean agreeing, though. It means recognizing their internal struggles and their stresses and their emotions. By using the OAR strategies to express empathy, we can build a foundation of psychological safety, which is essential in both trauma-informed care and in effective teaching and mentoring. And it will also help us to resist the temptation to go straight to suggesting solutions, which is often a stance that I know I take. So let's practice. Imagine a student comes to you because they're failing a clinical placement. Again, pause the presentation and spend a minute writing down an example of each of the OAR's strategies that we might use or mechanisms we might use to express empathy. Perhaps you had something like this. For an open-ended question, you might have said, "How did you feel when you found out you were failing?" Or an affirmation might sound like, "I appreciate how honest you're being about these struggles, even though it's difficult." A reflection might sound like, "You're worried that this could affect your future, and that makes you feel anxious." Or a summary might be, "Let me make sure I'm understanding. You care about your clients, but you're feeling lost after some tough feedback. You want things to improve, but you're not sure where to start. Is that right?" Principle 2. This is develop discrepancy. We want to help individuals recognize the gap between where they are and where they'd like to be. Here, we can help students clarify the gap between their current behavior and their goals. And this is not about confrontation, though. Motivational interviewing always avoids judgment. Instead, we gently guide the students to reflect on how their choices may be conflicting with what they say they want to achieve. We can use the OAR strategies again to help students identify this conflict themselves, because they're more likely to feel internal motivation to change. And we really want to resist the temptation to tell a student where we see the gaps are, because this external pressure is less effective to supporting change. Let's practice again. Imagine a student comes to you because they've been missing lectures. Again, pause the presentation for a minute and write down some examples of the OAR strategies to help discover discrepancy. Perhaps you had something like this. What are your thoughts on missing class? What are your thoughts on how missing class might affect your progress in the program? An affirmation might sound like, "It's clear you care about your education, even though things have been tough lately." A reflection might sound like, "You value your academic reputation, but sometimes it's hard to get to class on time." And a summary might sound like, "So far, you feel frustrated about falling behind, and you recognize attending would help, yet it sounds like there are barriers making it difficult for you at present." The third principle is roll with resistance. We want to accept and explore any reluctance or pushback rather than confronting it head on. When a student shows hesitation, shuts down, or pushes back, our instinct might be to inform or correct or persuade, but motivational interviewing encourages us not to resist that resistance. Instead, we step back and we invite the student to explore their reluctance. Again, we could use the OAR strategies to meet the resistance with curiosity rather than correction. And we can maintain an open, safe environment where students are more likely to reflect and re-engage. We definitely want to resist the temptation to confront the student head on. We want to minimize defensiveness and keep the conversation collaborative. So let's practice again. Imagine a student comes to you because they need help with written assignments, but they have not yet signed up with the Writing Centre. Pause the presentation, write down an example for each of the ORS responses that you can think of. Perhaps for an open-ended question, you had something like, tell me about your written work. What has supported you in the past? An affirmation might be, it takes courage to look for help, even if you're not sure you want to take that next step. A reflection might be, part of you wants support, but another part feels hesitant about making that move. And a summary might sound like, so far, you've shared that you're having difficulty with your assignments and you want to do better, but you're not sure if going to the Writing Centre is the right fit for you right now. The fourth and final principle is support self-efficacy. We want to reinforce the individual's belief in their ability to make positive change. In motivational interviewing, we work to reinforce hope and confidence. Mentoring becomes about showing the student how capable they are already, which helps them build resilience and self-trust. Even if a student is struggling, we can reflect their strengths by using the ORS strategies. Highlighting past successes and affirming the student's capabilities helps shift that focus away from feeling stuck and towards a feeling of being empowered and to take that next step. And again, we really want to resist the temptation to suggest ways that we can help. Instead, we want to encourage change talk. Let's practice again. Imagine a student comes to you because they are struggling to get along with a student colleague who is not timely in their project group work. Pause the presentation again to write down some examples of some ORS responses you could use. Perhaps you had something like this for an open-ended question. How have you managed teamwork challenges like this before? An affirmation might sound like, it shows dedication that you care about your work and you want to find solutions. A reflection might sound like this. It sounds like you've been trying to communicate your concerns and you want to create a functional team environment. And a summary might sound like this. So you've not dealt with peer challenges in the past. You've already started brainstorming solutions, and you're committed to making the collaboration work. And that's a solid foundation. Let's talk about what is called change talk in motivational interviewing. Change talk is the person's own statements that favor movement towards behavior change. These are not your reasons or your advice, but their own words that express desire, ability, reason, or a need to make change. Why does it matter? Well, research shows that people are more likely to actually change when they hear themselves argue for it. When someone verbalizes change talk, it reflects their internal motivation rather than responding to outside pressure. And that's why we call change talk motivational gold, because it's a powerful predictor that someone is considering and more likely to attempt meaningful change. As educators and mentors, one of our key roles then is to listen out for and recognize change talk in our graduate students. Those statements that signal a willingness or openness to positive change. So what does change talk sound like in this context? You could look and listen for phrases where students express desire. For example, I want to be more punctual. Or listen out for phrases that suggest a reason. It would help me do X if I could do Y. If I stop procrastinating, then I will have more time to relax. Or perhaps they're going to demonstrate a need. I need to, or I have to. For example, I need to get a better study-life balance. Change talk can be subtle, though. It might start with uncertainty, thinking about trying, or a tentative statement like that. But these tentative statements are valuable. When you hear these, reflect them back and affirm the effort and help students clarify their own motivation. Recognizing and responding to change talk supports graduate students' growth, resilience, and self-direction. So how do we elicit it? Well, we can prompt this kind of change talk with open-ended questions like, what would you like to be different in your life? Or if things were exactly how you wanted, what would that look like? What are some things you wish you could change? Or what goals do you have for your academic clinical work? Once we've heard some change talk, we want to be able to respond with it. And once again, we can use our OARS strategies to respond and amplify the students' own change talk. This creates an encouraging space where students can hear themselves advocate for positive change, increasing their readiness and their momentum for action. Pascal's insight is at the heart of motivational interviewing. When we help our graduate students articulate their own reasons for growth or change, we foster genuine motivation rather than imposing our own advice. Motivational interviewing is not about convincing, it's about facilitating discovery and ownership. By integrating motivational interviewing into our student mentoring role, we can create a culture of empathy and empowerment and growth for our graduate students. And when we prioritize self-efficacy, we support long-term success. So I invite you to try some of these motivational interviewing strategies in your mentoring conversations. Note how this style elevates our practice, helping students become resilient professionals, prepared not just for their academic success, but also preparing them for their future clinical work. So to summarize, these 4 principles, expressing empathy, develop discrepancy, roll with resistance, and support self-efficacy, they're not really separate steps. Instead, they interact and reinforce one another throughout the ebb and flow of a mentoring conversation. When we use these principles together, we create a mentoring space that aligns with our trauma-informed care values. It strengthens our connection and it promotes self-directed change and growth. As faculty and clinical educators, we can adopt these tools to meet students not just where they are, but walk them towards where they want to go. After listening to this talk, you might take some time to reflect. Which of these principles do you already use? And which ones might you focus on integrating more of intentionally to support graduate CST students? Thanks for listening, and I look forward to sharing your motivational interviewing stories sometime.